This is Dr. Thomas Klein. I am a chronic disease and rare disease specialist here in Raleigh, North Carolina. I'm talking to you from my office. We're going to discuss the second myth. Last time we discussed the myth of anyone can become addicted, and there were a couple of questions. We discussed type 1 and type 2 addictions, and you can Google that if you want to read it, and you Google the word medium, ABC, Klein, and that'll get you to a discussion about type 1 and type 2 addicts. Second question is, a lot of people have been asking me, why am I talking about addicts? I thought we were talking about chronic pain. The problem is everybody with chronic pain is being accused of being an addict. There are even talking heads that say anyone who takes opiates is automatically an addict, and I could tell you that's not true. The other question was about who are the 10 million people that take opiates long term? Nobody really knows, so we at JATH, Educational Consortium, LLC, JATH, Consortium, Educational Consortium. You can find it at jatheducational.com. Anyway, we developed a catalog of rare diseases after we did a poll and found out that 95% of people, of the 10 million who take long-term opiates, have one of many rare diseases. So we've changed the term chronic pain patients, CPP, to patients with long-term rare diseases, rare painful diseases, and that's what we need to be talking about because we now know who they are. These diseases like CRPS, interstitial cystitis, et cetera, which you will find if you Google medium catalog Klein. And it's time we all learn, especially emergency room and doctors, that people who are on long-term pain medicines are not faking. They're not doing it because they got a bad back at work, and they're not doing it because they've got a sore knee. So on to the topic today. We have 2/3 of our 10 million people with rare diseases being currently cut off their medication by doctors who don't understand what's going on and who are following the instructions of the CDC, which we will discuss in the next myth. It's causing unbelievable, horrible, wrecked lives. These are people with pain so horrible that you can't imagine. I was talking to a young woman, 20, the other day, who's got a funny vascular problem in her stomach. She gets intestinal obstructions. The pain is so bad, she passes out. It was so bad at age 20, she couldn't get out of bed, take a shower for 2 weeks. So these are serious diseases. So what's happened? We've had 5 drug wars, started with Eisenhower. This is the first one with serious collateral damage. And it's because of this. The CDC guidelines were written by 3 people. One of them, his name is Roger Chow, C-H-O-U. Roger Chow runs a big CDC shop at the Oregon Health Sciences in Portland, Oregon. He published a paper that was included in the CDC guidelines that basically says, and he's said this many times, that the absence of adequate scientific evidence on long-term opioid therapy and the paucity of data is in striking contrast to the widespread use of opiates. They went on to say that opiates don't work for long-term pain, and they're too dangerous and they'll end up killing you. This is not true. It was a falsehood. Here's the logic. Nobody has ever done a controlled study to show that opiates are effective. And he says in his paper, no placebo control study. So you would take 100 people with horrible pain, these pain patients we've been talking about, treat them, and then take another group of 100 and not treat them for a year? Do you suppose this would get past an investigational review board? This is not honest science. I could say there's never been a study to show that lawnmowers reduce the size of grass. Therefore, we shouldn't mow lawns. That's the exact same idea. So we've got some serious explaining to do from this man and from the CDC about why they chose an unscientific statement that basically set off this whole horrible mess. We've got 6 million people whose lives have been destroyed. We know of 40 people who, because of this, killed themselves because they were taken off their medication since it doesn't work and it'll just kill you. Thank you. And next time we will have myth number 3. Thank you.